Scoliosis is an abnormal curvature of the spine that affects an estimated 9 million people in the United States. Most cases are mild, but some curves worsen as children grow, which can create serious problems later in life. Today, we're going to discuss scoliosis, highlight the symptoms and treatments, and answer all the questions about scoliosis on Ask the Doctor.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome everyone to Ask the Doctor, the show where we encourage our viewers to send in questions, and we'll be happy to respond to as many as possible. Now, it's easy to send in questions. You can just email me at questions@allhealthtv.com, or you can put them in the comment section on our Facebook page, Facebook at AllHealthGo, or YouTube at AllHealthGo. Finally, you can visit our website at allhealthtv.com. I'm Dr. Georgiy Brusovanik, a minimally invasive spine surgeon, and today we are going to talk about a medical condition that affects the spinal canal, the spinal column, known as scoliosis. Being that our show is called Ask the Doctor, let's kick things off with a Facebook question from one of our viewers. Kelly asks, what is a normal spine supposed to look like, and what purpose does it serve? Thank you for your question, Kelly. Great question. So the spine does a few things. It supports the human body. It supports the soft tissues. It allows us to move freely and bend. It protects the spinal canal, thereby the spinal cord and the nerves, where your nerves and spinal cord descend from the brain and then the nerves spread to the extremities. This allows us to control our movements. So a normal spine, when viewed from the side, actually has a bit of an S-curve. You can see that there's an S-curve in the portion that corresponds to your neck that faces forward, a curve, a C-curve facing backwards in your mid-back, and finally, your lower back goes back to a C that's open to the back. Now, that's on a side view. On a frontal view, a typical spine is straight. Side view and front view. Now, with scoliosis, on the frontal view, you'll see a bit of an asymmetry, and oftentimes it's a rotational problem. It looks like we have another question from our viewers. This one is YouTube, question from Antoine. Antoine says, I have a neighbor who developed scoliosis later in life, and I want to know what it is and what causes it. So scoliosis is an abnormal condition of the spine in which the spinal canal, the spinal curve, is sort of in this S shape in a frontal plane. And again, it's a rotational problem. Your spine may curve to the right or to the left, and there may be more than one bend. Frequently, we refer to it as a compensatory curve and a structural curve. Structural curve is the one that's there all the time, and the compensatory curve is what allows many of us to keep our head right above the pelvis. It compensates. So from behind, a normal spine appears totally straight, and when there's scoliosis, you can see that there's a bit of a bend, especially when one leans forwards, you can capture a lean to the side. So there are 4 types of scoliosis. The idiopathic scoliosis, that's the most common type, and it's usually diagnosed in someone who is about to become or just became a teenager. As these kids are about to enter the period of life where they grow really quickly, this is what fuels the spine that is predisposed to a bit of a bend to bend further, and a lot of scoliosis progresses during that time. Now, neuromuscular scoliosis sometimes develops in individuals who can't walk due to a problem related to their muscles. These types of curves are very severe, and oftentimes you see kids diagnosed with neuromuscular scoliosis very early in life. Degenerative scoliosis is the most common type in my practice. Now, that's a type of a curve that develops later in life as the discs degenerate asymmetrically. Oftentimes, it begins in the lower back and is frequently associated with back pain as well as significant stiffness. Then there's also congenital scoliosis. And that's a type of scoliosis that we see in little kiddos once they're born. That type of scoliosis oftentimes results in kids needing an operation. And it can result from malformations in vertebra that will reliably cause the curve to progress. Okay, so we just got our first question on the website, and it's from Lourdes. Lourdes asks, my daughter is a healthy 10-year-old kid, but after finding out that her friend's older sister has scoliosis, she's afraid that she's going to get it too. I thought scoliosis was something that only older people get. Is that not the case? And does something like this affect the whole back? Lourdes, thank you for that question. So people of any age can develop scoliosis, a type of scoliosis, and the majority of those afflicted with scoliosis find that it's during adolescence, as they enter their teenage years. Now, scoliosis can develop in infancy or early childhood, and the primary age of onset of scoliosis is 10 to 15 years old. So with approximately 3 million new cases that are diagnosed every year. About 3% of kids in the US develop scoliosis. According to American Academy of Orthopedic Surgeons, a governing body for my specialty for orthopedic spine surgeons as well, idiopathic scoliosis occurs 10 times more common in girls than in boys, especially over 10, and we really don't understand why that's the case. So a human spine consists of 5 sections. There is the coccyx, the sacrum, lumbar, thoracic, and cervical spine. The 2 regions that are primarily affected here, you can see on the video, the sacrum, the lumbar spine is the lower back, and then we ascend to the thoracic spine that's held pretty stable by the ribs, and finally your neck, the cervical spine. But the 2 regions that are most commonly affected by scoliosis is the thoracic spine, or mid-back, and the lumbar spine. Despite the fact that the thoracic spine is stabilized by the rib cage, it's still common to see both structural and the compensatory curve in that region, especially in teenagers. Now, the lumbar spine, which involves essentially most of our weight-bearing energy and has the tallest, most dynamic discs, lumbar spine develops scoliosis more often later in life as those very discs lose height and result in a deformation of the human body. There are some differences according to age as well. Adolescents, most cases in the thoracic spine. Adults, seniors, mostly lumbar spine or lower back. So it's not atypical for someone with adult onset scoliosis to complain of significant low back pain. There are some signs and symptoms for parents to keep an eye out: uneven shoulder blades, uneven shoulder height, uneven hip height or position. You can find that when your kiddo bends forward, you'll see some asymmetry with regards to their rib cage, and we're going to talk about that a little more in a minute. And you can actually find that the entire body kind of leans to the side. And again, that's more with the elderly, where they don't have such flexibility to compensate for a structural curve. And finally, where your head is no longer centered on top of the pelvis, that's where I find elder patients will have a lot of pain. For those of you keeping score at home, we've gotten our second question via Facebook, and this one is from Cassandra. A nurse in my daughter's school called me a few days ago and said that she noticed her leaning to one side, my daughter, I assume Cassandra, when she was walking down the hall recently. The nurse suggested that I get my 12-year-old tested for scoliosis. I guess my question is this: how does scoliosis get diagnosed? Sandra, that's a great question. Thank you for sharing with us. So there are a number of ways how a doc may be able to diagnose scoliosis. There's something called the Adams forward bend test. Essentially, if you stand perfectly square behind your kiddo or in front of your kiddo and you have them throw their hair forward so that it doesn't obscure your view, you ask them to put their hands together and sort of lean straight down with their feet square against yours. In someone without scoliosis, as they lean forwards, you'll see that their thorax is totally even, like two equal hills that meet right in the middle where the spine is. But in someone with scoliosis, because of the rotational element, you'll see that the hills are no longer symmetrical. And that is a positive Adams test. Now, keep in mind that there's quite a bit of a margin of error, probably no less than 10 degrees. Don't panic if that happens. You can live your entire life with scoliosis. Please don't let that scare you and make you catastrophize. If you see a curve, a doc may also use something called a scoliometer, which is essentially just an industrial level that's fitted with a round kind of convex bottom that allows you to lean it onto the back, and then you could see a little air ball will move to one side or the other side if there is asymmetry. Physicians can also use a CT scan, an MRI to diagnose scoliosis, and of course, X-rays are probably used most often. When we obtain these X-rays, we use something called the Cobb method, C-O-B-B, where we draw some horizontals at the most asymmetrical vertebra and then align those to figure out the angle between the vertebra. And again, even with that, there's at least a 5-degree margin of error. I just want to again encourage you, if you have questions, don't hesitate, and we'd be happy to address as many as possible. Thank you again in advance for sending us all these questions.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.
Welcome back. So scoliosis can be graded based on its severity. Now, this gradation is really mostly relevant to the idiopathic type, the kiddos. So mild scoliosis is between 0 and 25 degrees, really 10 and 25 degrees, because anything less than 10 degrees is sort of normal physiological asymmetry. Moderate scoliosis, 25 to 45 degrees. Many of these kids may also require no treatment, and some actually are often offered a brace to try to slow down the progression of scoliosis, especially if they're about to go through their growth spurt. Severe scoliosis, that's 45 degrees and above, and many of these kiddos will be offered surgery, but that in itself is a bit controversial as well, and there's definitely a need to have a long discussion with your doc about the long-term repercussions of scoliosis surgery. Here's another email from one of our viewers. This time it's from Madeline. Madeline asks, my son was recently diagnosed with idiopathic scoliosis. His doctor said that he has a curve of 37 degrees and he wants him to begin wearing a brace. My son is pretty upset about having to wear a brace because he thinks the other kids are going to make fun of him. I'm so sorry. That's terrible. And I'm sure a lot of kids feel that way. That said, does he really need to wear a brace at this juncture? Madeline, thank you for sharing with us the story. Unfortunately, due to the severity and the timing, it may be reasonable to consider a brace. But keep in mind that a brace is only effective if it's worn at least 20 hours a day. So if you think that that's going to be an absolute impossibility, it'd be good to have another discussion with your doc about whether it's even worth it. Living with scoliosis is not a sentence. So remember, this is not something that's dangerous or scary, but it would be worth it to get a second opinion. Bracing, if your growing child is going to go through the growth spurt, it may be reasonable. The brace tries to hold the body in a stable position, but again, the relevance of bracing is with the amount of hours of use. In the past, casting has been tried as well. Obviously, you can't take the cast off, and it really commits somebody to a treatment. Casts also have to be changed every 2 to 3 months. So again, not a minor procedure. And then finally, surgery. Despite everyone's best efforts, some curves do progress. And there is a significant argument about addressing scoliosis where there's clear evidence of progression. Now, the way that surgery addresses scoliosis is with something called a spinal fusion. There are actually a few other methods, but the spinal fusion is the most common. So in this approach, as you can see here in an X-ray, a curved spine is exposed, screws are placed into a curved spine, and then rods are introduced that are bent in only one plane. So the rods are introduced at an angle, and then they are rotated to provide a sweeping, immediate correction to the spine. Spine then appears much more straight, but that segment of the spine will lose motion. Now, a fused spine is not a normal spine, but if that means that we stop the progression, which may have its own deleterious effects, it's a reasonable thing to consider. Usually, there's going to be about a 6 to 12 month recovery period after surgery. Many of these kiddos will then need rehabilitation, physical therapy, and there are repercussions long-term as well. As you lose motion in that large segment of your spine, other discs see more stress, and we do see a significant number of patients, as many as 10%, come back with problems above or below. Physical therapy has been tried, and physical therapy may be beneficial in the hands of some providers. I personally am a bit more skeptical, but if a child is not in pain and you see a mild scoliosis, you may want to reconsider whether therapy is even reasonable. I would rather my kid play sports, and please don't worry about things like having a child wear backpacks on one side or slouch. The reality is we have great studies where kids with scoliosis were tracked for years and years, and we just do not find that these type of asymmetrical activities produce worsening of scoliosis. We have another YouTube question. This is from Carmela. Carmela asks, I was diagnosed with scoliosis as a child, but I guess mine was pretty mild because it never really bothered me. But now I'm in my 60s, I'm feeling pain in my back, and I'm wondering if it's a problem now. That's a really great question, Carmela. These are the kinds of patients who I help in my practice. We spend a lot of time addressing scoliosis in kids, but let's address scoliosis in seniors. In fact, I have a guest today, Peter, who had scoliosis surgery. It would be great for you to hear his perspective. Hi, Peter. Welcome to Ask the Doc.
Hello, doctor. How are you today? Thank you for having me.
Thank you so much for joining us, Peter. Tell us, what was your experience like? What were you experiencing before scoliosis surgery? What was rehab like? And how do you feel now?
Okay. My story is very much like Carmela's. I was diagnosed very typically with scoliosis when I was probably 12 years old in gym class. A gym teacher came around, or a doctor came and checked everyone's backs, and I had it. But it wasn't bad enough that they felt the need to do something right then. So the diagnosis then was just kind of like live with it. And I did. And I lived a very normal life. Yes, I had a slight curvature. I did not really have pain. I like to think it made me shorter than I would like to have been, but in truth, maybe that's just how it is. It wasn't until I got to my late 40s that it became like, I started getting pains, like Carmela said she made it to 60. I made it to about 49. When I was closer to 50, I started seeing doctors again about my scoliosis, and they decided you should start thinking about surgery. I said, well, when do I get surgery? I've avoided it all this time, and I lived a very normal life, played sports, did everything like normal people. And eventually they just said, you'll know when it's time. And eventually, structurally, my back just wasn't holding me up anymore. I was 50 years old, and it was becoming hard to stay on my feet for more than 2 hours a day before the pain was too much. And then I went in and I got my surgery. They did the surgery like you talked about. I got the titanium rods put in. It was a big surgery, and it is a big recovery. And it took me, I'd say, 6 months before I started feeling myself. And now that it's over, it's not perfect. I do not have back pain anymore, and I can stand on my feet all day and I can walk all day. But I'm not going to be hula hooping. There's a lot of physical activities. I'm not going to be mountain climbing. There's a lot of things I can't do anymore. And that's a little bit of the trade-off, right? They repaired a lot, but it's not a perfect fix. In my case, though, doctor, I'll wrap it up by saying, I felt it was a necessity because it was affecting my day-to-day life. And I was also very lucky, or my doctors were wise, that I lived a pretty full life until 50 years old before I took such a drastic step. That was my journey.
Peter, I really appreciate you sharing the story with us, and thank you so much for joining us on Ask the Doc.
Thank you.
Here are my thoughts regarding scoliosis surgery, especially for the elderly. I'm a proponent of surgery, but only if conservative care has been met and if the surgery corrects the problem that brings the patient to the office. It is not a one-to-one relationship between back pain and scoliosis. Some patients suffer from degenerative discs, some suffer from stenosis or other conditions. So it would be very important for your doc to truly understand, indeed with certainty, that yes, I can tell you your back pain comes from your scoliosis, because so many patients who come to see me find that that is not the case. It could be a number of other problems, as I mentioned. And with spinal degeneration, other structures degenerate, nerves get compressed. So it's very, very important before you rush into surgery that you obtain a solid diagnosis, that you know for sure that if you have scoliosis surgery, you will recover and you will no longer have the original symptoms. There are a number of ways to try to avoid surgery. There are facet injections that aim at back pain that results from the rotational element of scoliosis that hurts the joints in the back of the spine. The facet injections not only aim to help the patients, they also similarly solidify the diagnosis. And if you are sure that your pain is coming from those joints, there's something called radiofrequency ablation. They can desensitize those joints and again, avoid surgery. Physical therapy may help. And if you do decide to have surgery, the modern way to address scoliosis is not with sort of like a single swooping correction, but with these small incisions done on the side of the patient's body where we sneak in, remove each of these trapezoidal discs one at a time, and implant symmetrical cages, which will even the patient and make the patient back to straight in a frontal plane in a much more gentle and sort of a slow way. This may result in a faster recovery, and in many of patients who have the surgery, it also lowers the risk of problems above and below. Early diagnosis and treatment can improve the outlook of many children with scoliosis, and monitoring is particularly important during growth spurts. I just want to remind you, growth spurts occur between 10 and 14 years old for boys and 12 and 14 for girls. So if you're worried about scoliosis in your kiddo, please don't hesitate and talk to your doc. Most children and teens diagnosed with scoliosis can look at a normal life without surgery. So don't rush into anything aggressive. And for the elderly, again, I just want to make sure that before you rush into surgery, definitely get a second opinion. For those of you who've already had spine surgery for scoliosis and continue to suffer, that's still not the end of the game. Many patients who continue to have symptoms after scoliosis surgery can still be corrected in a modern, minimally invasive way. Just a reminder, you can catch our show every weekday at 12:30, and we'd really like to encourage you to send in more questions. You can send in questions at allhealthtv.com, or you can put them in the comment section of our Facebook page, Facebook at AllHealthGo, or on YouTube, YouTube at AllHealthGo. And finally, please consider visiting our website, I appreciate you joining us. Remember, surgery is the last resort. If you are being rushed into surgery, get a second opinion. And if you've had surgery and you're still suffering, you can still get it corrected and you can still have normal life. Thank you again for joining us on All Health Go on Ask the Doc. And I look forward to talking to you again. Thank you again, Peter.
Send in your questions to questions@allhealthtv.com or AllHealthGo on Facebook or YouTube, or visit the Ask the Doc page on our website, allhealthtv.com.